Hi all, today we'll talk about gallbladder, mainly gallstones and its issues in the Indian population. I am Dr. Raveshia. I'm a general surgeon trained especially in laparoscopic cholecystectomies. Gallbladder stones are very common. They affect about 5 in 100, mainly females. This is though a lesser incident than in Western countries where you have about 10 in 100. But I'm sure that Indians suffer more because this is a hub of diabetes. And gallbladder with diabetes is not a good idea to have. So gallbladder is a digestive organ. When I explain it to my patients, most of them actually are well aware of what gallbladder is. In Hindi it is called pit ki theli or gallbladder. Gallbladder is a small organ that is under the liver. Now all of us know what pit is. It is the yellow stuff that we vomit out when we get nausea. Our stool's color is yellow. That is because of the gallbladder which stores bile. The liver produces bile and gallbladder stores it. So this is an organ which is used for digestion in our body. So gallstones can affect anybody. Most commonly it affects women over the age of 40. When we were taught in medicine, in our medical school, it was fat, fertile, flatulent, over 40 years female. But we see that now a lot of people have gallstones, even males are affected by it. There are two types of stones. One is cholesterol stones, the second is pigment stones. Pigment stones are basically ones that are made from the breakdown products of our blood. Cholesterol stones are usually yellow stones, and basically obesity leads to gallstone formation. There are certain infections such as somebody's had malaria or typhoid and the gallbladder lining gets damaged, and you can get gallstones as a secondary cause for this. So the problems that are associated with gallstones, the commonest thing is that they are asymptomatic. A lot of people find gallstones incidentally on a routine sonography. What happens with most people, they're not aware of this, that they get indigestion, they get nausea, they feel full after eating a very fatty meal or a heavy meal, and that is the commonest symptom of gallstone. What we are worried about gallstones is that can lead to very serious fatalities. You can get infection in the gallbladder, which is called cholecystitis, which is exactly like most people have heard about appendicitis. So like appendicitis, you can get infection in a gallbladder where you have raised blood count, fever, pain, and sometimes this infection can lead to something that we call gangrene of gallbladder or a burst empyema gallbladder, and these are very, very serious conditions. Sometimes the stone slips into a very small tube which connects the liver to the intestine, and there, because of that stone getting stuck there, you can get jaundice. The way I explain it to my patients is that when the bile or the pith from your liver can't get into the intestine because of the stone, your stools become white, but your body will become yellow. All the bile that is supposed to go down into the intestine goes into your bloodstream, and you can get obstructive jaundice. Furthermore, your gallbladder tube connects with the pancreatic tube. All of you all have heard of pancreas. It's one of the most important organ in our body, and if that gets infected or the stone blocks there, you can get acute pancreatitis. Most patients have a very bad recovery from acute pancreatitis. So you have acute cholecystitis, obstructive jaundice, pancreatitis, and empyema gallbladder. These are very fatal conditions, especially in elderly people, in diabetics, people who had multiple surgeries. We can have a very tough time. The patient will have a tough time, and the surgeon who's operating will have a tough time. There are three varieties. There is cholesterol stones, which is yellow. There is pigment stones, which are dark in color, and they are, as I have told you before, these are breakdown blood particles which form stones. And there is a mixed variety, that is a cholesterol and pigment together. Cholesterol stones are basically made up of fat. These are yellow in color. You can have various sizes of cholesterol stones. All stones, whether they are bile, cholesterol, mixed stones, they all behave the same. It is not that somebody with cholesterol problem will have a different problem. A stone is a stone. A small stone, big stone, multiple stones, sludge in gallbladder. We just get powder of stones. All can cause all these complications that we've discussed. The pigment stones are made up from when your blood becomes old, the spleen digests them, and you get certain particles of your dead blood which is supposed to come to the liver and get excreted to biles. When more of your blood is breaking down, then you get these stones which are dark in color. These are called pigment stones. These are common in people with blood diseases. We occasionally find people with thalassemia, major, minor, multiple blood transfusions when taken in childhood, certain other hematological conditions. In younger people, you'll get pigment stones. So as we've discussed before, the commonest symptom would be they'll get nausea, fullness of abdomen, acidity-like symptoms. These are chronic symptoms that they can get, and they may not be aware they've got gallstones. Acute symptoms, as we discussed, are like appendicitis. They get pain, fever, vomiting. When we touch in the right side of the upper part of the abdomen, they get a lot of tenderness. That is acute cholecystitis. But gallstones can have various other symptoms like pancreatitis. They'll get backache. In obstructive jaundice, the eyes will be yellow, urine will be yellow, the stools will be white, they'll have fever with chills, and they can be very, very sick. So the easiest and the cheapest and the commonest way to diagnose gallstones is by doing a simple sonography. The sonography has to be done in a fasting state, because after food the gallbladder contracts when you eat, so the sonographer can miss it. So this is a mechanical problem. It is not like you've got diabetes, blood pressure, which I can give you a tablet and it'll settle down. All mechanical issues have a mechanical answer. The only treatment that any doctor can do for your gallbladder is to remove the gallbladder. There is a myth of a lot of people say, oh, can you remove my stones? Stones can be removed in a kidney. In a gallbladder, you need to remove the gallbladder because it's the gallbladder that is disease-forming stones. If I just remove the stones from the gallbladder, you'll get a recurrent stone. You'll have another stone. Gallbladder inherently does not have any function but storage of a little bit of bile. So if you remove your gallbladder, there's going to be no harm to your digestion. You will have a normal life. Your diet will be normal. So the only treatment we have is a surgical treatment for gallbladder. According to our books, anybody over the age of 80 with a single stone with no complications are the only ones where we can say, I don't need to operate on you, and we can observe it. Most people should have their gallbladders out if they have gallstones. So the gold standard treatment for gallstones is laparoscopic or keyhole surgery, in which we remove gallstones. Accordingly, this is a treatment that is very standardized and there are no other options for this. But depending upon what the patient has, there are times when we do an ERCP, endoscopic retrograde cholangiopancreatography, to treat acute pancreatitis, obstructive jaundice. In very septic patients, we can do a radiological intervention where we just put a small tube around the gallbladder to drain the pus, and then subsequently later on they all eventually require as a curative treatment to remove the gallbladder along with the stones. So as I said, the biggest thing that we worry with gallbladder is somebody getting pancreatitis, because pancreatitis is a very difficult organ to deal with if it is angry. Second, if they get infection in the bile duct, which is called cholangitis, the patient can be very sick with septicemia, fever, and you require a lot of other newer medical intervention like ERCP, stenting before somebody can touch your gallbladder. Most of the times in diabetics, a gallbladder infection does not behave well and it becomes very difficult. You can have a lot of morbidity, that is, patient can be very, very ill, and we can have a very tough time dealing with these patients. So there are a lot of patients with gallstones. We've seen many gallstones, but I will tell you about a very elderly, about 85-year-old lady who had a very big gallbladder. Gallbladder was very elongated, full of stones, more than 100 stones. Now she at 85 was asymptomatic before this people diagnosed it and we found out that she had gallstones, and then she ended up with all complications, possible complications, with pancreatitis, obstructive jaundice, acute cholecystitis. Fortunately, we were able to treat her laparoscopically and endoscopically and she went home. But she was one of these cases where all of us were worried how she would behave. I think the only takeaway is please don't ignore it. Don't confuse gallstones with kidney stones. Most of the patients come to us and they tell us that, oh, my friend had a stone which passed away in the urine, or somebody's told them don't get operated, the stones are very common. But that is when they're talking about kidney stones. Think if you have gallstones, you are symptomatic, see some qualified doctor, do your sonography, do your blood test, and before complications, you should take them out. Now we can't predict when you're going to have a complication. We've had gallbladder stones when we've told patients to get operated, they've come after 5 years with nothing happening to them. And there have been patients whom we send them back for testing, blood tests, they've gone home, shadi hai, exam hai, they've gone abroad and they've called up from there, oh, it has got infected, it's got jaundice and other problems. So we would like to operate on your gallbladder when it's quiet, when you're happy, I am happy, and we both have time. Not as an emergency or not with complications. So gallbladder, I've been doing gallbladders for 30 years now. In fact, we were the first ones when the laparoscopy era of treating gallbladders came in, where we didn't even have a camera and we were looking visually through a scope and trying to remove gallbladders. Over the period, the changes happened in 91, 92 when laparoscopy has picked up, and I've been doing gallbladders ever since. Probably got numbers over thousands. I think we operate on gallbladder almost 4 or 5 a week, and it's a very common surgery. With the population increase in weight, in diabetes, cholesterol issues that the modern world is facing, all of us have been doing a lot of gallbladders, and it's become one of the major routine surgeries that we do every day.